Welcome to our very first episode of Roll Call, TTSH Nursing's very own podcast, brought to you by TTSH Nursing Organisation Development, or TTSH Nursing OD for short. TTSH Nursing OD looks at how we can help our nurses build better team dynamics and foster positive and meaningful relationships at work. This helps us to remain adaptable and resilient to the many changes that healthcare brings while staying clear and focused on our purpose. I'm Kim.
And I'm Tiff. We are your hosts for today's episode. We are both senior staff nurses who have been working in Tan Tock Seng since 2020. We are best friends since university and we are currently colleagues as well.
So this being the first episode of our podcast, I thought I'd share my heart for this project before we begin. So Roll Call was conceptualized to encourage raw, genuine and intentional conversations within our nursing community. We hope that this can also be a platform to have meaningful discussions about the experiences of our ground nurses, changes and directions from our management, and to also, of course, celebrate our nurses. We believe that this will help strengthen our bond and build purposeful relationships with one another.
So for my non-nursing friends tuning in, Roll Call this term is what we call a gathering of nurses at the start of our shift, where we gather together and we'll share meaningful, important information and discuss them with each other. And this perfectly describes what this podcast is about. So we have a good mix of nurses features as well as nursing chats and anything nursing really. So episode will be released every 2 weeks on YouTube and Spotify.
And with that, let's begin today's Roll Call!
So, to start it all off, we were thinking who is best to kick off this podcast? And obviously, honestly, the only person that came to our mind, of course, has to be our previous public administration winner, the Nurses Merit Award winner, her World's Woman of the Year 2020, as well as the President's Award for Nurses 2023 winner, Dr. Hoi Shu Yin, our Chief Nurse.
Welcome to our podcast! Thank you so much for agreeing to join us, and we hope that you'll be able to share more about your heart for our nurses, and of course we want to find out more about you as well.
Sure. I'll do my best.
Okay, so let's jump right into the question.
Sure.
The first question, by the way, our questions are a mix of questions from us, things that we are curious about, and also questions that were submitted from the ground, okay? So the first question, which was something that was brought up a lot, and people are many people are curious about. What was your nursing journey like from being a nurse to becoming our chief nurse?
Wow, that is about 23 years ago when I graduated from King's College London. I completed my bachelor there. And then at that time I didn't really want to come back to Singapore, to be very honest, but because of a 9 years bond, I had to come back. And TTSH is my hospital of choice that time, because the culture of being a very caring place and all. But really, I started my journey in 2001 when I was a staff nurse, and then that's where I started to really I started to take care of patients. I was in the medical ward for about 9 months. Then from the medical ward, I moved to the surgical ward, and then in the surgical ward, I was also stayed about 9 months. But from medical to surgical, it was quite a different experience because the patient profile, the tempo in the wards, the activities are all very different. Then after that, I got posted to ICU. So that was in the medical ICU. That was in 2003. Do you all know what happened during 2003?
SARS.
Yes.
Yeah.
We were in primary school.
Okay, so SARS. So I was in the ICU, I think, for about 3 months. Then, and then SARS hit TTSH, right, in one of the medical wards, and that was a moment of, I would say, a pivotal moment for me, where I really learned about courage, and I really learned a lot from my seniors, who, despite not knowing a lot about SARS, the time I remember in our first town hall, we were even being told that we don't know what we have, what we call the PPE, the personal protective equipment, whether it's sufficient, but this is what we got. So, and in the ICU, you have to intubate patients, I think the exposure risk is very high, but despite that, I see senior doctors and nurses stepping into the ICU room to take care of the first patient who they intubated. I was so amazed by them, and that really built my courage and helped me see the meaning of being a nurse, right? To be able to save lives. And so then I spent most of my ICU days taking care of SARS patients, and I have my my moments of that pride whenever we able to see a SARS patient walk out the door. Yeah, so or rather being transferred to the general ward. But back to my journey. So it was really a planned rotation from through the different clinical disciplines. Then there was so ICU. After I spent about 9 months or so in ICU. Then I went to, where did I go? I went to a paying class ward. So that was B1. It was a cardio ward. So I do have to move around quite a bit. But the intent was to give me exposure to the different clinical disciplines. And also to get to have a sense of how hospital processes are like. So that was a planned rotation for me at the time, because I think I did receive a scholarship, and then I think that was a program that was kind of planned out for me. Then after that, I went to paying class, and then that's where I because after the ICU experience, I feel clinically more, I would say, I gained a lot of knowledge. So clinically, I feel that I'm more astute. So then I started to do a little bit more teaching work, guiding the new nurses in the medical private wards, and also I have the experience of taking care of a different group of patients, and also started to try out some teaching role. At the time I was SSN. Then after that, I moved into nursing service, where a year of rotation was given to me to try out teaching. So I was a clinical nurse educator in one of the levels, or in the medical discipline, and then I learned a lot alongside the nurse educator. Then after that 1 year stint, I moved back to nursing service, and then I started to, what did I do? I think, I can't remember which one comes with, I think JCI. The time was, I think the hospital, as a hospital, we decided to, go for the JCI accreditation, and then I was very much involved. And then after that, hospitals started to think about, developing our own clinical decision support system, moving from manual documentation to electronic documentation. That's where I have my exposure in IT as well. Then I was also seconded to ministry part-time, I think, that time to start to do a manpower study at TTSH and all. So I think in the last, the first 9 years, I was rotated through different clinical disciplines. Then I was given opportunity to try out teaching, looking at some management work, like looking at manpower. That's why I really gained a lot of my knowledge in determining nursing manpower and all that. Then later, I have a little bit stint at ministry to look at policies. Then after that, I actually took a year out, took a year out because I have to, for family reasons. Then I came back, and then I started my portfolio in nursing quality and patient safety. So then after that, there was 9 years of directorship, being an ED, assistant director, deputy director, before I took on the chief nurse role. So it's been like that for 20 years.
Wow,
a lot of
that's
exposure.
amazing.
I can't count with my hands are not enough to count my toes.
But I'm really very grateful, because I was given the opportunity to try out different things. And sometimes I really do not know what I know. So a planned program kind of exposes me. Then after that, from there, I identify key areas where I want to further develop in. So that is.
So when they asked you to be CN, how did you feel?
I was like, why me? I was like, it's okay. I remember discussing it with my peers, and I wasn't really ready to kind of take it up, because I think the first thing is that I'm not sure, but I would think for most people, is whether you will be up for the job. Actually, there's quite a lot of self-doubt, and that's one. The second thing is that you very much, I think that's the first thing. The second thing is very much whether you think you'll be able to cope and be able to maintain certain balance, and be able to, and how much of your time will be required from you, right? And whenever, nurses, when we do things, we want to give the best, right? And we want to give the best to the people that we're taking care of. So, but I know, after talking to some peers and really seniors, I think at the end, what kind of what made me decided to, I don't want it to sound cliche or altruistic, but I think at the end of the day, it's the sense of gratefulness. It's a sense of gratefulness. I share about my rotation, the journey that's been mapped out for me, and the opportunities being given to me. I must say, I didn't pay for my graduate program. Government paid for it. I didn't pay for my masters. Tan Tock Seng paid for my masters in KM part-time. And then finally 2018 when I did my doctorate of nursing practice with Duke School of Nursing, I didn't pay for it. So I must say that I'm really very grateful for a lot of opportunity and many people who has helped me grow me, and develop me, including a lot of nurses. Right. So at that point when I took a while to consider, and so at the time we felt that okay, when the call comes, I think we should respond, and so it's with that sense of gratefulness. But of course, being a mother of 3 with a busy husband as well, working in another hospital, I have to ask for permission, right? So, and rather not so much permission, but really support. Right? Whether my husband feels that okay, as a family we can do it together, because you can't do it together. I feel taking on that position, right? That leadership. So he was like, he told me that I know that you have to do it because you want to create change. And I know that you will not settle for anything but creating the change that you want to see. So that was like, you sure? So that's it. So then I made that decision.
Wow, we love supportive spouses.
Honestly, that's amazing. That's the first time I ever had the full rundown of your journey.
I think a lot of us, we just know CN as CN, but the route to get there, it's wow. I really
respect.
Really respect.
So on that, actually a lot of us are curious. What does the Chief of Nursing do?
So maybe I ask you, what do you think of Chief Nurse do on a daily?
What policy comes to mind?
Policy. I think a lot of ground nurses. I'm trying to see where they're probably we always see CN at the those important events, or she'll come and talk to us, listen to us. But I think maybe that's like that.
But I think engagement is one big piece. So when I get into the role, right, I think one of the mantra for me, is that as our nurses support and care for patients, then my role is to care for nurses. So well, it's good for me to know that you sense my presence. That one of the things I think that it's part of my work is the engagement, because that's really important. But being chief nurse, right? Chief means there's this leadership component. Right? Chief means the highest level of leadership, right, for that fraternity. And then nurse is nurse, right? Nurse by profession, and I talk about taking care of nurses. So I think when you're a chief, you cannot settle for just settling what is a day-to-day issue. You cannot just settle for managing day-to-day issues, because like what Florence Nightingale said, right? If you just maintain and hold what you're doing, you're actually regressing, because the world is progressing. So if you just stay stagnant, you're actually regressing. So I thought that was very powerful by someone who lives a century year ago. But I think that is a strong reminder. As a chief nurse, you really need to figure out what is the next step, because you need to move the profession ahead, so that they are always the profession or our nurses are kept in pace, right? And that we're able to manage what's the challenges, or also be able to capture the opportunities that we can catch hold on. So really what chief nurse really have to focus a lot of time, I feel, and it's quite difficult given the daily operational work, things that may drain you and things, and every day is a different day. It gets interesting, right? But really we do need to carve out time to really think about the future. So that's what we call strategic planning, right? So strategic planning is very important, and there are many different tools that we use, but now for me is to really look at the external environment. So external. Okay, so we use the SWOT to. So you look at the strengths and weaknesses. So that is the assessment of your internal environment. So what are our strengths and what are our weaknesses? Like from there, then you know what are the areas that you should continue to build on, right? To build on your strength. And then for your weaknesses, sometimes you know that there's weaknesses, but it's to monitor them so that they do not go into something that you can't manage subsequently, right? So that is the SWOT is S for strengths, W for weaknesses.
Yep.
Then you have opportunities, right? The O and the T. So opportunity is scanning the external environment.
Yep.
So it's very important to look at what is the aspect, how does the external landscape look like, right? How has it evolved, and what are some of the opportunities, right, that you could see, right, for the profession.
Yep.
So some of the opportunities for us, I think in healthcare is really looking at the role of the nurse and how the role of the nurse can evolve, right? When we want to look at caring for the patient across the continuum of care. So a lot of resources have been given to acute hospital because that's where the intensity is, right? But actually if you want to look at care for the patient more longitudinally, we need to look beyond. Right, we need to look beyond the acute hospital. So how would the role of the nurse change, right, when you want to care for patients beyond the hospital walls? Right. So I feel that it's another opportunity. So the policy work, right? Then knowing that there's healthier SG and now there's age well SG, then how would that come in, and how would nurses be empowered to take on that pivotal role, right? To connect with our patients and continue to care well for them. You know, so that's one. Then threats is like, you know, it's part of the external assessment. So threats, you start looking at, you know, what are some of the vulnerabilities, right? And then what are the forward challenges. So one of it would be, of course, manpower. So there is a global competition for manpower and nursing in particular, nurses, because you see that acute shortfall in many different countries. And also this prevailing, I think, you know, lower birth rate issue and all that. So we are not able to kind of replenish our workforce, right, and things like that. So these are two key threats, and then we need to actively look at them. So that's why, you know, we start looking at, you know, workforce transformation work, digital transformation work, which is like innovation, bringing automation, all these things to reduce the reliance on manpower. So if we don't do it, because these are all initiatives that will take years to develop. So if we don't do it now, right, in my term, which is like, should I say 3 terms is like 9 years, but sometimes things will change. So if you don't start thinking about it now, it won't happen 9 years down the road. So we have to start thinking and planning for it now. So actually you ask me what's the key role of trainers, I feel that a part of the policy, the day engagement, these to me are all important things, but you really need to plan ahead.
Okay. So that's many portfolios and many things under your wing. And I think earlier you also mentioned that you have family and your husband is also in healthcare. So as chief nurse, how do you then balance your work and your personal life?
Balance, I think there's no balance at all, I think. But I think it's not about, okay, when we think about balance, sometimes we compartmentalize our life, if that's what we're looking at. But I think different people frame balance differently. But I think trying to move away from the idea that you can compartmentalize your life. I think as a leader, in fact, I think even for nurses, generally we don't quite, I don't think we can compartmentalize in order to achieve balance, but it's to find that sense of harmony, right? So another term that people commonly use is work-life harmony. So work-life harmony means this sense of control. This sense of control, but doesn't mean that it will be the same every day. So let me give you an example, right? That particularly during the COVID period, the 3 years where, you know, we have to go through the peak and trough, you know, and you know, the changes and be able to plan ahead so that we are always ready for the next wave. So there are really true peaks, right? Where you really be spending a lot of time at the workplace and all, and even maybe at home, and you start thinking about certain things, right? And then you so that we are better prepared. And so that's the peak period where really the workplace demands a lot of your time. But there's also trough period, right? There's also period whereby, okay, when things are more settled, and that's where you protect it. You protect it, and then you really focus on resting or doing what is important to you. So when it comes to family, is then to, if we know that this particular period, you know, particularly you need to give a lot of time to work, then is to work out with the family, you know, what are the important things that cannot let go, right? And then figure out with the children, when's your exam? Your key assignment, what do you need mommy to help you with? And then figure out what are those time periods, and then kind of block it in a way, and then communicate, and then together the team, you know, then some of them maybe will take on some of your meetings, appointments and all that, and then you plan your leave in advance. In a way, you kind of sounds like a lot of planning, but actually sometimes you don't have. But I think it's understanding what is the expectations from both family, husband and children, and then be able to carve out time. And again, a lot, and this is speaking from a mother now. Sometimes when you're with the kids, right, you're the family, you may be there, but your mind is not there. So again, you know, part of having that sense of work-life harmony is making every moment count, whether it's at work or with the family. And try to avoid this multitasking thing in your mind, because it's just going to worn you out and burn you out. I must say I'm not there yet. I'm guilty of this
Life is a journey.
Yes,
for everyone.
Yeah. But it does sound like your job has a lot of changes, and you're constantly asked to adapt to different situations at all time. So if you want to share personally, what would you say is the best or worst part of your job?
Wow, this is a tricky question.
There's no
Saying
bad
the
part.
worst is like, okay, but I did think about it. What did I think? Okay, I think the best thing is, of course, every level we have a reporting officer. We always report to. So I have report to CEO right now. But I realized that what I think is the best part of the job is that you have a lot of autonomy. You have a lot of autonomy, and that comes because there's a lot of trust. There's a lot of trust from the leadership, right? And there's also a lot of trust from my team, right? And also my peers, right? The other directors, COO and CEO, of course, CMB and all, but my team as well. So I think the best part of it is that you feel that you're able to drive things, and that you have more things in control. But then with that, you need to use it responsibility and be accountable, right? So I think that's the best part of it. Because whatever that you think, okay, I think I really, I think we need to do this, we need to do that. You can actually make it happen, right? Together with your team. And so I thought that's the best part. The worst, so-called worst part, right? I think is those moments where you feel quite stuck and you feel that it's out of your hands, and you feel that you need to do more, but you really can't. So let me share with you, I think the lowest bottom, I feel really quite low, is during the COVID period, where there's nothing much I can do to support our international nurses who, I think the countries were all locked down, and we couldn't really, they really couldn't find that opportunity to visit their family as often as they would. And so so there are moments like that where you feel that I really need to do something, but the situation has it that you can't. So yeah, I think so.
Because I remember when, we started out in TTSH when, like, during the COVID year, 2020, and I remember that you became CN in 2020 also,
yes,
right?
I remember
The year
2020.
itself.
Yeah, the year itself. So I remember, because we are going through so much already during our transition as ground nurses, right? And I was like, I cannot imagine becoming CN like during the pandemic, like how heavy that was probably for you. Like really, I was like, how is she doing it? Honestly, really, I remember I was thinking it. I was like, wow.
That period was very intense.
Yeah.
And I would say because of the changes, and you're constantly worrying about what will happen next, and sometimes you don't know what will happen next. And it's like a lot of times we like hope for the best, hope that our plan will in fact we plan a lot. We may have over planned, like we plan for ramp up that we need 200 over ICU beds and all that, and we said okay, that is disaster, but we still have to plan. So we did a lot of plan. We may have over planned, but that is preparation. So it was a fairly intensive, but I must say that people call me the COVID CN, because that is how that is my leadership journey right in the beginning. But I must say that we were focusing on managing the pandemic. It was like everybody was coming together, and then we are all have a very common goals, I would say, and the focus is there. So itself is a great training ground to build relationship, to get to know people, and then that's where you kind of know. I think we focus a lot on communication to the ground, communication to the leaders, communication between each other, and so I pick up a lot of those things. So in that sense, it was intense. It sounds hard, but yet everybody was kind of working towards the same thing. So now back to post-pandemic BAU, right? You have various business as usual, BAU pressures, and so you become like, you realize you have to multitask quite a bit. And some of the skill sets that you don't have begin to see, oh, okay, I need to do more things. I need to do better in this area. So you become a little bit more exposed. The time you're riding along during COVID, riding along on the shoulders of the giants, like CEO, CME, and you learn so much from them.
So on that note, was there any point in your career that you wanted to quit or you regretted your choice to do nursing?
I think I wouldn't say quit, but I think we will reach a time point where we will have our crossroads. Right? Everybody, like, I feel, whether you're a nurse or not, when you reach a certain stage, you will be thinking about, is this it? Is there something else? Is there something that I can do differently? What is my aspiration? What's the longer term dream that I want? And is this aligned with what I'm really passionate about? Right? So I think I hit my crossroad. I think it was 5th year into nursing. So, all the rotation and all that, in nursing service. Then I think that time focusing on manpower, then tapping into IT, clinical informatics and all that. Then I asked myself, hey, I find that I don't have a craft to call my own. It's different where, you have peers 5 years in the journey, they say, okay, I'm an ICU nurse. I don't advance deep, I'm a orthopedic nurse. But I said, who am I? Just like, because of the rotation and all that. Because of rotation all that, then you realize that I have no specific craft or no specific specialty that I can call. So that's like, then thinking about, okay, maybe I should do something really different. That was where I thought, okay, maybe leaving TTSH, leaving healthcare, try something different, will help me see a different world. And then you will probably see what your strengths, what your skills that a nurse could bring into a different world, right? Then I was really toying with that, but I haven't finished my bond, so I had to calculate the bonds then after that. But then I think things got turned around where I said, okay, why not I just think about trying something, just study something quite different. So then I kind of look at what are the local part-time programs, because that time I think I just got married and then pregnant with my first child, somewhere along that line. So I needed some programs that's local and part-time. And then, I chanced upon the first Master of Science in Knowledge Management with NTU. So then it was a 2 years part-time program. So I jumped on it, and then since then on, I think I got what I want, which is understanding what's different out there and interacting with different people. And then, of course, I find, okay, I stay with nursing. Then from there I decided,
back around. Full circle.
Since that, I've never thought about switching out.
Wow, okay.
Wow.
Oh, thank you. That was a tough section to get through. Thanks for sharing so openly and vulnerably with us. Okay, so moving on, let's talk about culture. So one of the most important ingredients for a thriving organization is actually culture, which especially where the important is building one that aligns our actions with our goals. And so we are curious, what culture do you envision for Tan Tock Seng Nursing to build towards to?
Actually, culture is people, right? People shapes the culture. So I think for us, in healthcare, we talk a lot about patient safety culture, and that means having an open culture where everyone is free to really raise issues they're concerned about, and then the just culture, knowing that even if things goes wrong, there will be a fair assessment, right, of what is so-called attributed to the system, the bigger system, or what is attributed to the individual. So this is what we know within nursing and all, and we're trying to propagate that, right? But when you look at culture as a whole, right, specifically to nursing culture, I think apart from we've been building up a culture of empowerment, right? So we brought in shared governance, where we want to empower nurses from the ground to be able to make decisions together with nurse leaders, right? In areas that affect your practice, that affect your work life, that affect your development and things like that. But maybe today I will throw one more angle to the culture, which is about what can we individually do as a nurse to build a culture that is uniquely TTSH nursing. Right. So one of the things that I will be sharing with the nurses, right, which I share with the nurse leaders, but I have not come down to the nurses, is really thinking about our role and the culture that we want to collectively build, right? So being an innovator, right? Because I think we need to have that culture of curiosity,
Yeah.
the culture to be able to see that, hey, actually, this is not so ideal. You know, the maybe chest tube bottle keep tipping over. Is there something we can do about it, right? You know, and so having that curiosity, and more than curiosity, is to know that, hey, I can do something about it,
Yeah.
right? So that is the innovator culture.
Mm.
Then I think closer to heart when it comes to clinical practice is what is using evidence in our care.
Yep.
And very often we follow guidelines, and this comes down to like rules, but actually it's following evidence, right?
Yeah.
And very much the bringing in evidence into our practice is driven like by nursing service, by key people who reviews the evidence and all.
Yeah.
But I really hope that nurses feel that actually evidence can be in your hands. Just like the doctors when they see patients, right? They look at this patient, they identify some of the key problem lists for the patient, or diagnosis and all that. They do go and read up like up to date and all that to really specifically, you know, see what's the latest evidence and all that, and then tailor their advice and their management of the patient according to what's the latest. So I think nurses at point of care can refer back to evidence, or sometimes even, you know, after that period, the episode of care, then you may want to think, okay, this is what I'm currently doing now. Is there a better way to do things? Is there evidence to, is there a new product, for example, for this type of wound, you know, that people are trying out, and then should I recommend it to try and bring it into our ward, right? For example. So is using evidence and believing that evidence will improve care and try and bring it to the bedside. So evidence-based practitioner, the innovator, and my favorite. And this tagline came not from me, from I believe is our previous group CEO, Prof. Philip Chu, is this idea of family caring for families. Yeah, so this is a culture. Family is us as a family. So the nursing family, nursing team, seeing ourselves as a family. And then within the beyond nursing, together with our doctors, allied health, you know, and all, seeing that as a wider family. You know what families do, right?
Take care of each other.
Yes. We look out for each other. And we are always one step ahead to support the other person, or to prevent them from doing something, to not prevent, but to watch out for each other. And to make the additional effort so that things will be better for them. That's family. So family, caring for families. So this idea of caring for families is not to see patients on their own, but to see their wider network and social circle. Because remember, we want to provide care for them beyond the hospital episode, right? So in order for them to continue to receive that care, we need to look at their social network, their wider system, and how they can tap on the resources outside them, so that they can be cared for, or better cared for when they are discharged. So it's this idea of family caring for families. And last one, which I think is something that is growing important, especially when we talk about sustainability. And you know, sustainability is not just the green efforts, but it's also business sustainability, healthcare sustainability, right? Because we do see healthcare costs escalating, right? And also how to keep it sustainable. So this idea of being a steward of resources, right? And I believe it doesn't rest in the hands of leaders being good stewards of resources, but in every practitioner, every nurse, right? And I see it happening, right? Sometimes, you know, the caring for patients and all that, we were knowing the patient's socio-economic, you know, background and all that. Sometimes we'll recommend different dressing products so that help them, but probably, you know, something that they can afford, but something that will also be effective, right? So we do that for them. And sometimes I know nurses do go the extra mile to help patients financially, you know, by referring to our MSW clinic and all that. So being good stewards of resources. And I think in my context as a leader, when I look at manpower, we talk about global competition for manpower challenge. I think all the more we need to be stronger stewards of our manpower resource. And really see in what areas can we do our work more efficiently.
Thank you so much. That was a lot to digest. A lot of very good points, and I hope that listening to that really empowers our viewers to not just. I think nurses, a lot of people have this perspective that nurses, you know, we just kind of take a back seat and we just follow instructions, follow orders and all that. But I hope that really empowers and builds that confidence in us in the direction that we want to go towards, where, you know, we take a much more active, intentional role in contributing to the healthcare team.
And actually, it's very encouraging. Like, you know, as you share about the culture of innovation, evidence evidence-based, I actually can remember certain practices that happen in the work that I've encountered. It's like, oh, okay, this is from the culture that you mentioned, like the chassis bottle. Then you came up with the frame, then there's innovation challenge going on. It's really nice to see how everything ties back and trickle down from the leadership position down to the practice, and every one of us actually does have an impact on it.
Great.
So our next question, actually someone very curious wanted to ask you, what advice would you give to a nurse who aspires to achieve a position like yours? Future CN!
I think what advice, I truly believe in two things. One is really figuring out where your passion lies. And because that drives the motivation. I think for me, what becomes stronger and stronger over time is the passion to create the change in the environment that would support every nurse to thrive, to be their best self, right? So that is my passion. And the second thing is really learning, right? You realize that we will never be able to learn enough, but yet there's so much things out there that we can learn from. And so, and very often we kind of expect things to happen to us, like we kind of like hope that maybe someone would. Maybe it's a kind of like recognition thing that I hope someone will offer me a chance to go for this program, that program and all that. But really, honestly speaking, if you know what your passion is, what is it that you want to try out, sometimes it may not be clear yet, but you say, okay, maybe there's some area I can try and see, have some interest in it, then learn, go for the learning. And so, because then you will be able to first really understand whether this is really a particular area of interest. But secondly, you will get noticed. People see that you have an additional level of knowledge and that you are able to think differently, right? And then they will be able to see, okay, maybe I should let you try out something, right, within nursing, right? Do something different. So I'm sure both of you must have done your own learning on how to do a podcast, how to plan for a podcast, right? And that's what makes you stand out, right? And then I hope this is your area of passion, but even though it's okay, it's an experience. So I really believe in kind of have an end in mind. Where's your passion, right, in your profession, and then think about the learning, how to drive your own learning to get there. And then sometimes it doesn't have to be entirely your own. Then have that discussion with your supervisor to see what are the opportunities. So that's probably two key things.
It sounds a lot like you can really take control of your journey. Have a lot of autonomy in your progress and go as far as you want to do with the resources that you have. Okay, so to wrap it all up, would you like to share some words of encouragement or advice to our viewers?
I think it's probably, I'm thinking quite hard about this. To be very honest, I hope I can come up with some acronym or something that you can remember, right? But I probably just share some things that I think people have said that touched me. And I think because of that, I can remember among other things. I mean, I think one of the things that I would like us to realize as nurses is that we are very uniquely positioned to care for the very vulnerable. I think we are uniquely positioned most times, especially in the acute hospital setting, where we can take care of vulnerable patients, vulnerable families that no one has that privilege of doing. So if you see that as a privilege, then it's really about how can we then leverage on that privilege to discover the meaning behind that privilege. So I hope that all nurses will see that you are uniquely positioned, you are given this privilege, and then think about how best can you make use of this privilege to discover the meaning behind lives, behind the work you do. And last but not least, I think we talk a lot about person-centered care, right? And then we ask ourselves, what does that mean? So one of the leaders, which is our previous CEO, Prof. Eugene So, kind of in one engagement session with the nurses, say, actually person-centered care is seeing the person in you, seeing the person in the other person, seeing the person in our patients, seeing the person in their family members. I think when you frame it that way, you realize that they are a person.
Yeah.
So that would probably be what it is to kind of bring back the art of nursing by knowing that your uniquely position is a privilege, and also to see the person in whoever you're caring for, including staff. Right, to see the person in your staff.
Yeah.
Yeah. Okay. So yeah.
Thank you so much. That was such a lovely session.
Yes.
Yeah, I've honestly get a lot of insights and wisdom, and I feel so cared for.
So sadly, that concludes our first episode of Roll Call. Once again, thank you so much to our
Yay,
CN,
thank
Dr. Hoi
you.
Shu Yin,
Thank
for
you.
joining us. Remember, you can also check out our podcast on Spotify at Nurses of TTSH. Stay tuned for our next episode coming up on the 28th of May, where we will discuss more about nursing and mental health in light of Mental Health Awareness Month.
Yeah, do give us a follow on our channel and hit the subscribe as well as the bell button to get notified when we post a new video. On top of that, give our channel some love and engage with us in the comment sections.
For more updates and opportunities to contribute to our future podcast episodes, follow us on Instagram and TikTok at Nurses of TTSH. If you have any topic suggestions or anyone you would like us to feature in upcoming episodes, feel free to drop us a DM as well.
Great job.
Thank you!
Thank you.
Yes.
And with that, we will catch you in the next roll call. Have a great shift, everybody. Bye.